Assalamualaikum, Ms. Shifa. Today, our group will going to present about the difference between traditional medicine and modern medicine. Here, we will start with the introduction first, followed by traditional medicine and modern medicine, and lastly, conclusion.
As you know, medicine is the science and practice of providing medical care to patients, including diagnosis, prognosis, prevention, treatment, palliation of injuries or disease, and health promotion. Nowadays, people got two ways to cure disease by using traditional medicine or modern medicine, and it depends on their belief and religion to decide which one is the better one to use depending on the disease itself.
This medicine has differences in terms of effectiveness. Traditional medicine can be administered orally or externally in the form of ointment. Thus, it is rarely sterile or saturated mix, exposing it to germs or pathogenic organisms, resulting in long-term effects if left untreated. Meanwhile, modern medicine aims at utilizing only the substances that are being used to cure specific diseases. The drug produced by drug manufacturers is much higher quality, and this product goes through a different evaluation process to make sure it is safe to be consumed, has a better seal, and is also sterile from the beginning.
Traditional medicine and modern medicine have many differences in terms of dosage. For example, traditional medicine have given depending on the needs of the patient and the experience of the practitioner. However, modern medicine are formulated with the exact amount of active ingredient. In contrast, traditional medicine drug doses may be less standardized and more erratic. Meanwhile, modern medicine have the production, packaging and labeling of medicine are controlled to guarantee that the patient is given the appropriate dose. Even though traditional medicine has the range can be used in traditional medicine 1 until 3 grams of herb per day depending on the patient condition. However, modern medicine specific dosage guidelines are set by clinical trials such as drug might be 20 mg once per day.
The ingredients used are different for both types of this medicine. Traditional medicine is an ancient cultural practice that relies on herbs, divination, and superstition, while modern medicine is based on scientific research and use pharmaceutical drugs. I will explain about the ingredients used in these two medicines. The ingredients used in traditional medicines are natural ingredients such as leaves, flowers, and animals. It is different from modern medicine. This medicine uses active ingredients and inactive ingredients.
Now, I will conclude our presentation topic that is traditional versus modern medicine. So, traditional and modern medicine both have own benefits to save patients. Modern medicine includes terms of efficiency, dosage, and ingredient. For efficiency, modern medicine show high quality of long process medicine, and for dosage is a crucial method to require taking suitable dosage for adult and child. As for ingredient, this may cause a consequence for person health that some people will have allergic and so on. Compared to traditional needs a lot of practical experience. And medical needs high technology of medical equipment to save patients and make the world better. That's all from us. Thank you.
Next, we will present about our second topic, which is should cyberbullying be prevented? We will begin with introduction first, followed by our point in this topic and conclusion.
What is cyberbullying? Cyberbullying is an activity that involves children, teenagers, and adults. Not to mention that cyberbullying can be the cause of death and emotional disturbance. Cyberbullying must be prevented so that generations will not expand this cyberbullying. Cyberbullying is very dangerous because it will affect your life and emotions.
Here are some impacts of cyberbullying. First, cyberbullying should be prevented because it will affect social life of bully victims. Bullies will spread out negative rumors and making things get worse. People who get bullied will struggling to be socially connected with people that around them. They affect how other people will perceive them and what they say. For example, bullies will send abusive and threatening messages or posts on social networking sites because bullies lack of moral value and less of sympathy and empathy. Cyberbullying will affect social life only victims, so cyberbullying should be prevented.
Cyberbullying can cause mental health issues. Cyberbullying shall be prevented as these matters could lead to serious depression and mental exhaustion for the affected. This is proven true as it creates a negative impact on the victim during their everyday routine. There are a few ways cyberbullying could happen. One of them is to make harsh comments about the victim, make threats, or intimidate them through communication services. Last but not least, cyberbullying happens when the criminal publishes or uploads sensitive images only to humiliate the victim, thus impacted the victim's life even more. Moreover, cyberbullying is now a disease in the modern world, and it shall be prevented to ensure a better life for future generations.
In addition, cyberbullying should be prevented because it can cause unproductive at workplace. For example, cyberbullying can result in a toxic work atmosphere that fosters conflict. The victim may experience stress, anxiety, and depression, which can diminish their focus, motivation, and overall performance. Next, cyberbullying can make employees to leave their work, and it also can make employees who are targeted may take more sick days or leave and affecting overall team productivity.
Goal.
In conclusion, cyberbullying needs to be prevented so that the next generations can live a peaceful life. In addition, society will also live in peace and be able to live a quality life. Cyberbullying needs to be prevented so that the death threat caused by cyberbullying can be reduced. Other than that, we can also create a harmonious atmosphere when we are at work. As a result, we can do our work in peace and tranquility. Lastly, we must prevent cyberbullying so that we can reduce the number of mental health patients in hospitals, such as depression, emotional stress, mental stress, and anxiety.